Hello everybody and welcome back to my channel. Today I will be talking about glaucoma and how it affects the eye. Glaucoma can actually end up blinding individuals, so if you want to learn more about this, then please stay tuned. Glaucoma is a condition in which elevated pressure within the eye subsequently causes damage to the nerve fibres that carry information from the optic nerve heads to the part of the brain that processes visual information. Now, the way you can think of this is like a wire and a plug. So essentially, you have a computer, which is the brain and the processing unit. You then have the wiring, which are the nerve fibers, which transmit the information, and then you have the plug unit, which you can think of as the optic nerve head. So essentially, there's a channel down which information flows. Now, what happens in glaucoma is the high pressure causes damage to these nerve fibers, and these nerve fibers gradually get lost. Over time, the more nerve fibers that are lost and damaged will mean that this will result in a negative impact on the patient from the perspective of visual functioning. So there are two components to this. Initially, glaucoma will affect the visual field of a patient. So what the visual field is that when you look straight ahead at something and you maintain your gaze, everything that you can see around you in your peripheral vision and then your central vision also, that's classed as your visual field. So in glaucoma, what initially starts to happen is the peripheral field of vision will start to get affected as the nerve fibers get damaged and lost, and then over time the fibers will get damaged more and more extensively, and this will mean that initially the peripheral vision was affected, but over time this will start getting closer and closer towards one's central vision. So thereby you'll find that patients start bumping into things, patients will find driving difficult, patients will find navigation at night difficult and challenging, and this is as a result of loss of fibers, and these fibers that get lost will ultimately mean that you start losing, as I said, initially peripheral vision, and then later you start losing more and more fibers close to central vision also. So essentially it starts off in the periphery, so the outermost aspects of our vision and our peripheral field, and it slowly but surely starts to come closer and closer towards the center. So in terms of the actual vision, so what I mean by that is the visual acuity, which is what you read on the chart when you go for an eye test. So you may find that some patients with glaucoma can actually still read the bottom line of the reading chart, but they may have quite significant visual field loss. So the two components are different and shouldn't be confused. So vision or visual acuity is the smallest text size that you can see, and that can be checked at both distance and at near, whereby your visual field is, as I've explained, is the peripheral aspects of your vision, and that can be thought of as the navigatory type of vision that one requires to fulfill day-to-day activities. So the purpose of this video was to try and explain that what happens in glaucoma is we get progressive loss of visual field, which starts off in the periphery or the outermost aspects of our vision, and then it slowly starts to come closer and closer towards the center. As it gets closer and closer towards the center, the field of view and our world as we perceive it will alter, but vision/visual acuity can be maintained to a very good level until the latter stages of the disease. So it's very important to understand these two differences, and if you're a patient, I hope this now clarifies what may or may not have been occurring with respect to damage to your visual field and your level of vision. And if you're a healthcare professional, then it's important to explain this clearly to patients so that they are aware of what to expect. If you've liked this video, then please give it a thumbs up, click the like button and the subscribe button. As ever, thank you for your support.